Welcome back to Studying with Stephanie. Today we're going to talk about connective tissue and we're going to dive more into bone as a connective tissue. So, what is bone made out of? Well, bone is made out of calcium, calcium phosphate, water, proteins, and cells. And those cells are called osteoblasts. As we know, blast build. So anytime you hear osteoblast, fibroblast, those types of cells are builder cells. So they're going to help with repair of tissues. When it comes to bone properties, bone is highly vascularized, and this means that it gets a lot of blood supply. And where that blood supply and where most of those blood vessels are along the shaft of the long bones, so the diaphysis of the bones. Bone also is a very rigid type of connective tissue. It's very rigid, but it's very dynamic. So it's going to hold our structure of our body, but with the muscles pulling on the bone, those tendons attaching to the bone and pulling on it, it is dynamic in where the bone now can move and allow for that pull from the tendon onto the bone to happen as well. So not only is it rigid, but it is a dynamic type of connective tissue. Bone is constantly remodeling through osteoblasts, those tissues that are building. And the cool thing about bone is when bone remodels, it doesn't lay down scar tissue. It actually lays down the same exact materials that it's made from. So bone is the only type of tissue in our body that when it heals stronger than when it wasn't injured if it is loaded correctly. And we'll go into that in a little bit. Bone is made up of cortical and cancellous bone. All right, so the cortical bone is that outer layer of bone. It is that hard shell. The cancellous is more in those long bones, and this is within the epiphyseal and the metaphyseal long bones. And this is more of that spongy type of material. When you look at the bone, it has more space, and people with osteoporosis, that cortical bone is not as affected as the cancellous bone, that spongy type of the bone. So this is more creating that lightweight of the bone versus that cortical, heavy, dense material. All right, and the bone is made up of organic materials and minerals and fluids, which all help to maintain the health and the nutrients of the bone itself. The minerals, specifically the calcium within the bone, help to improve the stiffness of the bone itself. And bone functions to provide us structure and support within our bodies. That's why, as humans, we're able to stand up because of the layout of our bone versus other animals. The structure of their bone makes them where they can go onto all fours and only stand for shorter periods of time. Bones also enhance the leverage. So through the different lengths of the bone and how the muscles and tendons attach onto the bone, the muscles are able to produce more leverage for certain movements and certain processes for our function. And then the bones also protect the organs. When we look at our rib cage, all of our strong internal organs are pretty much protected by those ribs. Because the bones are strong, they are going to protect and provide that support as well. Bones also are sites for the tendon and the ligament attachment. So the structure of our bodies and the movement of our bodies only occur by the bone structure and those tendon and ligament and muscle attachment through those bones. And then the bones, again, they store minerals such as calcium. So that helps as our body, needs different nutrients. Those bones can help release those minerals. And then the bones also withstand compression to our bodies. So as we're standing upright and gravity is pushing down on us, our bones help so we don't just flop over. We have that nice, strong, structured bodies. And then our bones are going to be the strongest under that compressive type of force, but they're going to be the weakest under the tension. So bones don't really do well to stretch. They do well with compression because they are that thick dense material, but then they have that cancellous, more spongy type of inside. They are really good at absorbing compressive loads. And then when we talk about bone development itself, like I said, osteoblasts, the type of cells that lay down bone, are always remodeling the bone. So the bone is always going through these changes where it's developing and building. And our bones get stronger as we progressively increase the resistance and the load to the bone itself. But our bones are developed through two different type of developmental styles. Through intramembranous ossification. Now, the intramembranous ossification more so comes through the bones of our skull, our facial bones, our ribs, and our clavicle. So that's how those type of bones develop. But our long bones and the other carpal bones, things like that are not up here, they all develop through endochondral ossification. And the endochondral ossification has three different centers of healing. So our primary center of healing, the primary place that our bones develop from, our long bones develop from, and not our facial bones, are through the middle and the diaphysis. So the middle of the bone, that shaft, the diaphysis of the shaft, is where that primary center is. So when we think about more of that bone marrow area, that's where our bones are going to develop mostly from. And then the secondary place the bones develop from are the epiphysis, and that is the end of those bones. The end of the long bones are those secondary centers. So the bone develops from the middle, and then it develops from the ends of the bone. And then the last place the bone develops is from that epiphyseal growth plate. So the growth plate is actually between the primary, the diaphysis, and the secondary, the end of the long bone. And that is going to be, a lot of kids, when they get injured and they get injured by the growth plate, people are so worried because that is the tertiary part of where our bones develop. So if the kid is still developing, they're not going to have as much growth as they would if it wasn't injured at the growth plate. So that's why the growth plate is a cause of concern when it comes to bone fractures, because we want those bones to be able to grow to the size that they were supposed to and develop. So the growth plates are very important when it comes to children getting injured. And then when we talk about bone injuries, the primary type of injury that a bone can sustain is a fracture or a break. And a fracture or break can be caused by a significant trauma that's going to cause that bone to snap or to get a hairline fracture through it. And this also can be caused by submaximal traumas that are repeated, such as a stress fracture. And stress fractures are also actually the most common type of fracture to our bones. And fractures and breaks are determined through x-rays. That is the gold standard. It's pretty much novel against everyone that an x-ray can show a bone fracture or a break. And we're going to go a little bit more into the healing. So we talked about the developmental sites of the bone, but there are also different ways the bone can heal. The primary way that the bone heals is through primary cortical healing. And this is when the cortex itself tries to reestablish itself. So essentially, the developmental areas try to grow out and reestablish that bone integrity. Secondary cortical healing goes through 4 stages. And we're going to talk about those in a second. But bone, like I said earlier, bone heals stronger because it heals as its original tissue versus other types of connective tissue heal as scar tissue. Bone heals as its original tissue. So it's really a very good thing that when it gets injured, it can heal better and stronger than before if it needs to. Just like soft tissue though, bone goes through the 3 phases of healing: inflammatory phase, the proliferation or the repair phase, and the remodeling phase. During the inflammatory phase, the first 2 days or so, we have materials that get released from the cell, and the histamine and the serotonin that's within the cell gets released into the extracellular matrix, which then will increase the permeability of the tissues, and the kinin, which is another substance, gets released as well. So that permeability now increases, that tissue is able to flow more molecules in and out of the tissue itself. And then as this also occurs, the blood vessels start to dilate to bring more leukocytes for repair to the tissue itself. Now let's go back into the 4 stages of the secondary cortical healing. The first stage is the hematoma formation, or a bruising type of formation. So what's happening is, during this bruising phase, that hematoma happens, the bone fragments start to get cleaned up, and that inflammation is occurring for 2 to 5 days. And like I said, that intracellular materials, the histamine and the serotonin, get released into the extracellular space, increasing the permeability of the tissue, bringing on more leukocytes through the vasodilation. And then all of the necrotic tissue during this inflammatory phase, the hematoma formation phase, start to get cleaned up and removed out of the area. From there, a soft callus starts to form around the fracture. So the repair phase starts to go on from about 4 to 12 days after the initial fracture or the break. And the bone, as the vascularity is increased through the vasodilation, more blood flow, that callus starts to form around the fracture, and the bone fragments start to join through the cartilage, and the cartilage or fibrous tissue. So when we talked about the primary healing, that's when the actual bone itself tries to connect to one another. So we have a fracture in the bone here. The bone actually tries to connect itself. That's primary. Secondary healing, the fracture is here, and we get this callus formation around that fracture, and that starts to close down and lay down cartilage or fibrous tissue, so that way the bone can start to heal. So after 4 to 12 days, we go into the third phase, which is the hard callus forming. So that soft callus is now starting to transform into a hard callus, and this is the modeling phase. This takes about 17 to 40 days, again, depending on a lot of different things. The ends of the fractures now start to bridge together. The ends start to bridge, and the soft callus is replaced by trabecular bone. So now it's no longer cartilage or fibrous tissue. It's now bone that starts to form and adheres and create this bridge between the 2 fracture sites. And then the bone starts to align, and the alignment is in response to how the bone is getting loaded up. All right, and then we go through the final stage of this secondary type of healing. Secondary cortical healing is the 4th stage, and that is the remodeling stage. And this can take anywhere from 25 days to 100 days. Again, it's dependent. So at this remodeling phase, the last phase, the cells start to mature, and they start to increase the bone density of the bone itself. So the bone has now, the bruising has occurred around it, the hematoma has formed, the soft callus has gone around that fracture, and the cartilage and fibrous tissue has now transformed into bone tissue. And at that final stage, now those cells have matured, those osteoblasts have matured, and the bone starts to increase in the density and start to get stronger at this point. And like I said, the bone healing, the reason the timelines are so widespread is because bone healing is based on so many different factors. It's dependent on blood supply. It's dependent on the degree of motion that is allowed at that bone. It's dependent on diet, and it's dependent on our hormones, our cellular environment. And as we age, unfortunately, that cellular environment does change. Like we talked about with cartilage, the hydration of those ground substances and the soft tissue start to change. And so it's not as hydrated, so it doesn't turn over as quickly. So it could take longer as someone ages versus a young, healthy individual that has good nutrients and good diet. And bones, when they are injured, as they're going through these processes, either they're going through the primary healing where the actual fracture is trying to union and join together, or they're going through the secondary healing, which takes places in all four of those stages. Typically during these times, a bone is going to be casted up or immobilized, and that is to allow for that whole healing process to occur. Typically, the bone is going to be immobilized for 3 to 8 weeks so that all of those processes can occur and that bone can get its original strength, and then we start loading up the muscles and rebuilding up on all of those other processes, the joint immobilization and the hypomobilities within the joint and the atrophy of the muscles. After the bone is fully healed, then we can start to go through those phases. As things are changing in therapy though, what's happening is before we used to never see anyone with a fracture. A fracture would heal, and then maybe if the patient needed to come to us, they would for strengthening or hypomobilities to regain range of motion at specific joints. Now, more and more, you are seeing patients with fractures because, like I said, in that third phase of healing, the 17 to 40 days, the bone is going to align in response to the loading. So we can play critical roles when it comes to how that bone is loading up and how that bone is healing. So that's really nice, and that's really good to see that change in the therapy paradigm, where fractures, we never used to see them before, and now they're coming in, and we're able to help with that healing process and to help facilitate a good environment and talk to our patients about diet and about moving and all of these different things that we can play a role in. So that's bone, and that is how bone heals. If you have any questions or comments, please drop them below. If this helped you, please go ahead and subscribe, share this with your friends, and please, if you do want one-on-one tutoring, let me know. Drop it in the comments below and I will reach out. Thank you for coming and tuning in to Studying with Stephanie. Have a great day.